session. I really appreciate you taking time off from your work and coming. So just quickly jumping on to our topic today, that is donning and doffing of PPEs. So before we start, just some housekeeping rules. So this is our clinical skills lab. So as our hospital rules, no mobile phones are permitted, and no food and drinks are permitted here. We have the fire exit just at the front from where you enter, and toilets are just to your right when we exit the room. And if you have any questions during the entire session, please stop me and ask the questions. So just going on to the objectives of today's training session. So we will be looking at how to put on the PPEs and how to remove them. So donning and doffing of PPEs. So have you used PPEs before?
Yes.
Yeah. So basically we all know how to put the PPEs on and take it off, but just today we are going to be focusing on the sequential steps, the exactly what steps needs to be followed. So what is the purpose of PPE? Yes, that's right. So basically to prevent the spread of infection. So that is to protect self, protect family members and the other community, and including the patient. So the sequential steps of PPE is really helpful and is important to prevent that transmission of infection. So what do you think, in which cases you need PPEs, like a full set of PPEs, in which all cases do you need? Yes, exactly. So now we know there is a huge incidence of respiratory infections. So especially for respiratory, it depends also on what type of virus or bacteria is present. Based on that, we change our PPEs, especially the mask. If it is just like influenza or RSV, we can just wear a proper surgical mask. But if it is COVID or anything that's airborne, we will have to wear a proper N95 mask. So it just differs. And also in some gastro conditions where patients are basically having nausea, vomiting, loose bowels, in that case we have contact precautions. It's basically to protect ourselves from the fluid, from the bodily fluids. So that's one objective of our session today. So basically to demonstrate you, and you will be able to confidently follow the steps of donning and doffing of PPE. So I have got here a sample of our PPE trolley. This is a precaution trolley. So usually we have a basket, something like this. So this basket has got all PPEs in there, and we have got a list here written what should be in this basket. So for the ease of this training session, I have got the PPEs on top of the trolley just to help us use, and just to show you the steps of the procedure. I have got an infectious bin here. So what in this training session we are going to consider, this is the patient area, and I'm going to put my PPEs outside the patient area and then enter, and then after entering the patient area I'll remove my PPEs and dispose of in the infectious bin. So these all PPEs are single-use PPEs, so you just use it one time and just dispose it off. Yeah, so basically these are the equipment. So we have got gown, face shield, goggles, gloves, mask. So just for this procedure I have got the normal surgical mask, but if you're wearing N95, those should be, before you put any they should be fitted. A fit testing must be done, so that a proper fit is you get the proper fit, because everyone's facial features are different. So as per our hospital policy, we have annually we get the fit testing done, and usually the infection control department will send you an email and you book your appointment, get that done, and they give you the options for different kind of masks you can actually wear in the like patients who are in airborne precautions. So I've got the mask here and the hand wash, which is the most important thing. Now, before I start the procedure, I'll just give you one of each. So this has actually got the step-by-step procedure, and they will be all stuck onto the patient doors, like in each patient door. So you don't have, even if you forget the step, this is an easy reference. You can just go through that and follow the steps. So it's very easy one, and these pictures are taken from the ASTA, like the Australian Commission, and also from the CDC, Center for Disease Control. So they are very standard. It will be the same everywhere you go. So I know you both have worked in the outpatient department, so this kind of setup might be very different for you, like you putting on all the PPEs and entering the patient room, which usually doesn't happen in outpatient department. So I feel that this topic will be very beneficial for you, and you will be able to perform this procedure at the end of the session. So what I'm expecting is, after I perform the procedure, any one of you can volunteer and re-demonstrate the procedure to me. So yes, so you can have those posters, and I'm just going to start. The procedure. Going to place the bin here. I've got my sleeves up, and just for the purpose of procedure, I'm just taking off my glasses to show you how we put on the goggles. So I'm going to use the hand rub. Just do your hand hygiene. And then, so the first step you can see there, it is putting on the gown. So these are all just going to, this is all single-use disposable gowns. So just putting that on. Just tying these ties at the back, just like that. Just make sure it is securely tied. And then, so my hands are clean, my gown is clean. So next one in your step would be putting the goggles. So I've got the goggles. Is that right, or am I wrong? Is it? Okay. I'll just put the mask here. So in this case, I am using a surgical mask. So this surgical mask can be easily tucked in. If it is an N95, you have to really go on top. So it should be okay, but in N95, just make sure that you have N95 first on. So I'm going to put, so you can see the light blue side and the dark blue. So the light blue side goes onto you, just like that, and just back of your ears. Make sure it goes under your bridge, nasal bridge, and it is tightly secured. Just press it so that no air can get in and escape. So make sure it is safe. So I have got the goggles on. So what is next is our face shield. So you can see this face shield has got a sticker like this. Just going to put this here, here, just taking that film, protective film off, and then just putting this around here. So now the last one would be putting my gloves on. So just clean gloves will be fine, and please make sure you have the appropriate size of the glove. So make sure your sleeves are covered. Alright, so sleeves are covered, my hands are not visible, so I'm ready to go inside the patient room. Just imagine now for this session I'm inside the patient room. I have worked with the patient and I'm now going out of the room. So before going out, now I have to dispose of my PPEs. I'm not taking any of these outside. So in the wards, you will have patient room with the bins, with the infectious bin where you can actually dispose of these gowns and PPEs. So let's do from the first. So make sure you have the bins that can automatically open, or with your like a pedal bar is there you can open. So you can look in the sheet and tell me which one goes off first. Gloves. So now these gloves, so just consider the front part of my PPE is dirty. So I'm going to consider everything is contaminated. So what I'm going to do is I'm going to dispose of my gloves first without touching myself. Okay, so I haven't touched, so here, and then just making sure my finger is actually underneath, and then it goes away from your body, and then you're ready. Make sure you sanitize your hands. Okay, so what goes off next? My hands are clean now. Gown. So why are we not taking the shield yet? Because we are still in the precaution room and we are having a droplet precaution patient, so we're keeping it on. So I'm going to touch the back, not any part in the front. So these ones can be easily torn like that. Do like this. Make sure it comes off. You're not touching the outside part, and just like that, away from you, goes in the bin. And hand hygiene again. Alright, so obviously now the next one would be our face shield. So going like that, goes into the bin again. Hand hygiene. Now what's next? That would be our, make sure you don't touch the front, goes in the bin. Hand hygiene again. And the last part is our mask. Now with these masks, make sure you don't touch at the front, just straight goes in the bin. And hand hygiene. So basically you have done your PPEs, and every time you do the hand hygiene, making sure you are not infected, you go out of the room and then you do a proper hand hygiene with soap and water. So that's about donning and doffing of the PPEs. Now the N95s, if we are using, they can be quite they can cause a lot of pressure on your face and can cause injuries. So have you ever used an N95? Yeah. So you might, if you don't have a proper fitting N95, it can cause pressure along your nasal bridge and along your cheeks. So there are some dressings available which you can actually put on your nasal bridge, and on top of that you can put the N95 without compromising the the need So that's basically it. And any questions? Anything? So even if you forget the steps, you will have this on the doors. It is a very easy guide which will help you to do that. Now, can anyone volunteer to do the procedure? We will help you, so that's fine. Okay. I'll take your position, and if you can come, we will read it out to you and you can just do it. So, yeah, she knows what she's doing. So she's got her watch off and sleeves up, and then so first we are with hand hygiene. That's right. Yes. Yeah. That's good. And yes. That's it. Perfect. Carry there. So you have your goggles and the sheet. So you have one more floor there in the front. Yeah. Glass. Yeah. So you are ready for patient care. You have done patient observations. You have done some procedure. You are dirty now, and you have got the bins in the room for disposing the PPE. So you can start one by one. So first will be gloves, making sure you don't touch the dirty side of the gloves, and you do hand hygiene. And you move down. Yeah. Making sure you don't touch the front. Yeah. That's it. And you roll it so that, yeah. And then perfect. So always when you try to take it off, make sure you're taking it off towards the bin and not towards the patient. Yeah. Yeah. I should. Yeah. Yeah. That's it. happen. So it's always there in the room, in the patient room. You will have these PPEs. Now we can swap places. All right. So now, where do you find these precaution trolleys? In the storeroom. So most of the time you might not find proper supplies in there because the ward gets busy and they don't get restocked. So make sure before you take it to the patient side, they're all restocked, and if it is the supply is not present, we put the orders in and have sufficient supplies in place. And once the patient is discharged, now what you do with the trolley and the precaution boxes. So refill and take it back. Prior to that, you just give a good clean, disinfect it, because these boxes also have black ties, so you can actually tie the like whatever waste you have got in the room, you will tie it with that, and then refill this, give proper clean, and in the precaution trolleys itself, you will have patients' medications. So you will have to put it back, and yeah, so that's it. So this is all about donning and doffing. So how did you feel the session? Was it too complicated or just easy, or you just need to get a hang? Yeah, so you just need to get a hang of it. Just follow those guidelines, and you should be able to follow the procedure quite correctly. Um, what else? So I'll be sending out a feedback form where you can put your suggestions for improvement, and also there will be a small 5-question quiz which you can fill it out at your free time and send it to me via email. But if you have any questions